Just like you, if you have tartar on your teeth or dental disease in your mouth, your body is constantly trying to fight that infection. And your bloodstream is always activated, your immune system is always activated, and all of those bacteria and all that dirt has to get filtered out, causing a strain on your liver and your kidneys. So we like to keep the teeth clean and healthy so that it helps the overall health of the whole body. Also, if you have a toothache, you know you have a toothache. If your dog has a lousy tooth or a tooth that hurts, it's very hard to tell if it's having pain or not. So a lot of the stuff we do is very proactive, and we always notice that after a cat or a dog has a dentistry and they had a bum tooth and we take the tooth out, the owners always say, my dog is acting so much better and eating better and running around better. They come in the morning and they sign the treatment plan, and they go downstairs and they get a pre-medication, and that's to support heart function, also for pain and any pain during the procedure. And also a little bit of relaxation, because when they come to the vet they can be a little nervous. In order to clean and polish and evaluate all the teeth in a dog or cat is with anesthesia, because they move around all over the place and they won't tolerate sitting there with their mouth open. So they get an IV catheter. The IV goes in their arm, just like it would with you if you were getting anesthesia. And then we give them an induction dose of anesthesia, which makes them fall asleep, put in a breathing tube into their throat, and that gets hooked up to the anesthesia machine. They're monitored with blood pressure, EKG, pulse oximetry, temperature. We clean and polish all their teeth. We check for any kind of pockets or infection in the roots. If there's any indication there might be a problem, we'll x-ray the root of the tooth, and if the tooth looks damaged or infected or it has a cavity or a hole, we generally take the tooth out. And the teeth generally are too small to do a root canal, and also it's very, very expensive. So after all that's done and all the teeth are polished, and they get woken up, again with a licensed technician. Once they're fully awake, they get more pain medication after the procedure if any extractions were done. And all the technicians are very sensitive to how the animals are feeling, and they go home that night with pain medication and antibiotics.